that. Okay. And then I will pause it. Now, really excited about our speaker. Oh, thank you, Rebecca. I do forget. See, thank you. Welcome everybody to our Health Council Talk. Appreciate you coming on this Friday afternoon, especially as the holiday season is fast approaching, and I know people have a gazillion things to do, but we're really excited today about having two speakers with us who are going to tell us about the New Mexico Coalition to End Homelessness. As I told them, I think every one of our health councils, all of our communities are dealing with this homelessness issue. And we wanted you to know that there is a resource available to you. And so Leanne and Forrest are going to tell us more about what they do and how they do it, and how all of you health council people can tap into their network of resources. So I am going to, ready to go? Everybody ready to go? Oh, please put your information into the chat and we are going to proceed. So as we usually do, we are going to start with our land acknowledgement. So the New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory in the ancestral lands of the original peoples of New Mexico's Pueblos, the Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting our relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land. We respect all tribal nations' sovereignty. And in offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of the New Mexico's tribes and nations who are still here today. And we pledge our support and solidarity with them as we go forward. So thank you all. Stop sharing. And I'm going to briefly introduce our speakers who are then going to tell us more about themselves. But we do have today Lee Foster and Forrest Dudek, who are going to tell us more about the Coalition to End Homelessness, what they do, how they do it, and how we can work with them to support those in our communities who are insecurely housed or housed not at all. So Leanne, Forrest, take it away, please.
Great, thank you, Wendy, and thank you for the land acknowledgement as well. That really means a lot to me. So thank you all for attending this meeting today and being a part of our coordinated entry system presentation for the New Mexico Coalition to End Homelessness. My name is Leanne Foster, and I'm the Balance of State Coordinated Entry System Director. And I'll have my colleague go ahead and introduce himself.
Good afternoon. My name is Forrest Verde Dudek, and I am the New Mexico Housing Youth Project Manager for Balance of State at the New Mexico Coalition to End Homelessness. Good to be here.
Thank you, Forrest. And I apologize, I'm gonna do my best presenting. I'm just getting over being sick, so my voice is kind of catching up. So thank you all for being here to learn more about our coordinated entry system for New Mexico. So our overview of today's training is just going to be a brief overview of the New Mexico Coalition to End Homelessness, how the coordinated entry system works, who should use coordinated entry, and then our New Mexico Coalition to End Homelessness contacts. And just please know, although this training is about the coordinated entry system, additional in-depth topics will be briefly covered in order to provide context on how the system works and how it helps in the process of ending an individual or family's homelessness. So a little bit about the New Mexico Coalition to End Homelessness. Whoops, sorry about that. It's not working, hold on. Trying to find the back button. Here it goes. Jumping way ahead. All right. Oops. All right, so a little bit about the New Mexico Coalition in Homelessness. The coalition works in these major areas. First, we manage the Homeless Management Information System, or HMIS, for the state of New
Excuse me,
Mexico.
Leanne, are you hoping that you have a screen share on?
Oh, yes, I do. I don't. Sorry about that. Here it goes. You
Uh-huh.
can see my
Very
screen
good.
now? Okay,
Yes,
thank you.
ma'am.
All right, so the coalition works in these major areas, managing the Homeless Management Information System, or HMIS, for the state of New Mexico. We also operate the Coordinated Entry System. We provide support to homeless service agencies in New Mexico, and we advocate at the local level, state, and federal level for solutions to homelessness. So the New Mexico Coalition Homelessness have 2 locations. One is our Albuquerque office. So the Albuquerque office assists only with the city of Albuquerque and Bernalillo County. And the director of the coordinated entry system there is Alexandra Paseno. And then we have our Santa Fe office location. So this office assists the entire state of New Mexico, except for Albuquerque. And this is also known as the Balance of State, or BOS. We also have our admin team that is at this location as well. So the New Mexico Coalition Homelessness and the Coordinated Entry System. NMCEH implemented the Coordinated Entry System, or CES, in 2014. It creates real-time lists of households experiencing homelessness throughout the entire state. It provides a means to quickly and efficiently match people to available housing resources that best fit their needs. And the Coordinated Entry System facilitates the coordination and management of available resources. So a little bit about the Coordinated Entry System. So agencies that participate in the Coordinated Entry System use a common assessment tool called the VI-SPDAT. It's a vulnerability assessment to assess the housing and service needs of people experiencing homelessness. It helps connect households with the longest length of homelessness and the highest needs to available housing and supportive services equitably. It uses a no wrong door approach, so clients can present to any provider or access point and be prioritized for housing by completing an assessment or a VI-SPDAT. Coordinated Entry System is not connected to Section 8, public housing, or low-income housing units, and it is not an application for housing. And there's a really big misunderstanding when it comes to people thinking that it is like a wait list or it is a housing application, but that it is not. So what does coordinated entry look like? So coordinated entry has resource centers and access points. We do assessments, we problem solve, we prioritize and refer. So any family can present, through different avenues, which look like, hospitals, clinics. It's this really nice, neat cookie cutter kind of image, that gets them into permanent supportive housing, rapid rehousing. But what does it really look like? It's this mass jumble of, confusing connections, go here, go there, meet up with this person at this agency to fill out paperwork and assessment. It's really jumbled, it's confusing. A lot of these folks, they present either at hospitals who will then, navigate them to transitional housing. It's people who are we encounter at encampments or on the streets who are then directed to go to a shelter so they can get on a wait list. It's outreach, then they go to drop-in center, and then maybe they're connected to transitional housing or other shelter opportunities. So it's this big, huge, confusing, jumbled mess. And when I was, excuse me, when I was a DV advocate in Albuquerque at one of the Native medical facilities and agencies, it was really confusing for my DV clients to get into any housing because I myself wasn't entirely, sure how to get them connected to different agencies that would be able to assist them in getting into, housing or getting on their wait list. And so, as a case manager, who's supposed to have the resources and, the means to be able to help somebody who's, fleeing domestic violence, I was confused myself and frustrated. And I wasn't yet trained in how to fill out the VI SPDAT. And so I had to direct my clients to someone within the agency who was trained to fill out the VI SPDAT or the housing assessment so that it could be entered into a system and then they can be prioritized for housing. A lot of the clients that I work with, didn't feel safe, going into shelter, especially if they had children, just because of, kind of the stigma that surrounds, shelters and also not feeling safe. And so a lot of them, made the choice to, sleep in their cars or, couch surf or sleep, in tents outside. And so, it's really disheartening, to hear, that your clients are, in such a vulnerable position and not really knowing, how to get them into these housing opportunities. So you can imagine if I'm confused as a case manager, how confused they are as clients. And on top of that, they're being traumatized, by their experience. And just, the trauma that they've experienced. A lot of the women that I work with were Native American. And so a lot of that is, not really trusting the system, not trusting that things are going to work out, that these resources are really going to connect you to anything. And so it really took a lot of relationship building and understanding that there is a system out there that is able to help and assist them and get them connected to services. So you can imagine just if I'm, confused as a case manager, how confused it is as a client trying to get hooked in or linked into this, housing system for New Mexico that I didn't even know existed, and they don't really know that exists as well. So coordinated entry, we try to, explain it in a very simple way, which is access. And this means a physical or a remote access location where a person experiencing a housing crisis can be pre-screened for coordinated entry. Some examples include shelters, medical clinics, or street outreach. Then we go through the assessment piece to be completed for clients whose pre-screen indicated that the client is homeless, at risk of homelessness, or fleeing domestic violence. This assessment includes completion of a VI SPDAT and possible case conference. And then we go on to prioritization, which clients will be placed on a prioritized list based on factors reviewed on the coordinated assessment or VI SPDAT. The prioritized list will ensure that the clients who are most vulnerable have prioritized access to available housing resources. And then lastly, the placement or referral, where clients will be matched with the agency most appropriate to their individual housing needs and preferences. So the housing assessment really eliminates them having to go to every single agency to see if they're eligible for services, although they will have to go through that eligibility process if there is a housing opportunity available to them. And it eliminates, them having to go to all of those agencies to fill all of those applications. If we can just, shorten it down to a very limited list and ones that are specific to their needs, it allows for them not to have to go to every agency and re-explain their story over and over again. So access points. Access points, this refers to a place, agency, nonprofit, or provider that can assist in connecting a person or persons to a coordinated entry system and ultimately the VI-SPDAT assessment. An example of access points would be homeless shelters, street outreach, faith groups, social workers, food banks, medical clinics, or recovery centers who have been trained in completing the VI-SPDAT with the client. We never want to complete the VI-SPDATs and just give the housing assessment to them to fill out themselves. We always want somebody who's trained or who has gone through the training to the VI-SPDAT to conduct that with the client. So in a sense, you all would be considered an access point. All right, and then I'm going to hand it over to my colleague Forrest so he can take over.
Thank you, Leanne. So this is what the VI-SPDAT kind of looks like. And the reason why we keep using that word VI-SPDAT is because what it stands for is Vulnerability Index and Service Prioritization Decision Assistance Tool. And that's kind of a tongue twister, so we just refer to it as the VI-SPDAT, but that's this housing assessment that we've been discussing. And so the VI-SPDAT is a triage tool, and it helps to assess the health and social needs of somebody experiencing homelessness or their household and families to help match them with the appropriate support and housing interventions that are currently available in that actual community that they're experiencing this. And it's designed to measure acuity and risks to housing instability. And we do have several different actual assessments depending on if they are youth, if they're individuals, if they're couples, if they're families, and there's different questions based around what their actual circumstances are. And it's not intended to provide comprehensive evaluation of any kind. It's really just touching the surface of their living situation and trying to get them into the HMIS system to begin to access services. And it's not designed to look at eligibility to any specific programs. Like I said, it's just trying to get them into the system to be able to start to work and access programs. There are many ways for a household to end their homelessness, and using this assessment tool is only connected to some of those options, and it's through HUD-based housing. So with coordinated entry and the homeless management information system, that's a shared database that the coalition manages, and it's a statewide database. And that's where these assessments are entered and scored. And that score helps us to prioritize folks to see what their actual needs are. And it's not a perfect system, but it gives us some idea. And the coordinated entry works in conjunction with HMIS to create a list to help to see what needs are in the community and those clients' actual needs, and to try to get them connected with services. The projects who participate in coordinated entry, they'll use that list. And oftentimes we will do case conferencing using that list of folks that are in the system, and try to see and talk with case managers and work through the actual needs of the clients to find the proper placement for them. And so with that prioritization and that scoring on the VI-SPDAT, typically the higher the score, the higher the service need for the client and the more need for wraparound services. And one of the options and housing options for folks with those higher scores would be permanent supportive housing. And typically that's for folks that score over an 8 on this VI-SPDAT assessment out of a possible 17. And those folks the folks that do qualify for permanent supportive housing would be considered chronically homeless, which would be like 12 months of homelessness. And also they have a documented disability as well. And so families also would score a 9 above that. And so if you notice, there's a possible of 23 instead of just the 17 on individuals. And that reflects back to the differences between the assessments and the questions that are asked, depending on if they're in a family or if they're by themselves. And then for folks that aren't needing those higher levels of wraparound services, we have rapid rehousing and transitional housing. And for individuals, that score would be from a range of 4 to 7. And for families, that would be 4 to 8. And typically, if you're an access point and you were to be doing these assessments with clients, you wouldn't know the score until we enter that into our system, into HMIS. And then if you were able to connect them with services in your community, then you could request to have access to that score. But that's something that we typically keep on our side, just to know. And we typically don't share that information with the client because it can lead to false expectations and ideas. Like Leanne had mentioned, that there's a lot of confusion around this assessment, and if it's a waiting list and if it's an actual application for housing. And this just gives some idea around what these clients do need. And then that process begins using that score and that assessment. And there is a protocol in place to address exceptions to those households whose service need might not accurately be reflected in their score. And in that process, we can advocate for those clients if they do need housing and their score doesn't fall into those realms that I just spoke about for rapid rehousing or transitional housing, and even for permanent supportive housing. So placement and housing programs and eligibility, and these are the HUD-based housing. There's other available housing that is not HUD-based. And so the permanent supportive housing is, like I said, is for chronically homeless as defined by HUD. And that's a length of homelessness that's over 12 months. And it can actually be stretched out in a 3-year time period. But I would have to have 12 months of homelessness within that 3 years, as long as we can document that. There's also the high service need based on that assessment score and the way they answer those questions. And the actual disability. So we do need a documentation of disability for that permanent supportive housing. For rapid rehousing and transitional housing, the client would have to be literally homeless as defined by HUD. And so with that homelessness, we would also get some documentation of whether they're staying in a shelter, whether they are staying in a vehicle and accessing food banks, and somebody within the community and a stakeholder or provider in the community is able to see that this client is in need and document that, and we get that documentation and move forward with trying to get them into the rapid rehousing program or transitional housing program. To receive that referral for housing, the resources must be available and household must meet the eligibility requirements. So there is no guarantee, and in some communities, there isn't even a provider to actually provide these housing programs, unfortunately. So as we go through the state, we are encountering folks that are facing these situations and difficult situations with their families, and coming to realize that there is really no housing programs in their area. So oftentimes they might have to relocate or try to go through other kinds of programs that aren't necessarily like housing programs. It might just be a general assistance fund or something like that to be able to assist them to get them back on their feet. So who should access coordinated entry for assistance? Like I said, the households who are presented as homelessness or homeless as defined by HUD, and they have pretty strict requirements for what they define as homeless. And so we do have like families that would be doubling up, and that would be defined as homeless by McKinney-Vento, which is through the Public Education Department. And that's a little different than defined by HUD in these housing programs that I just mentioned. So with HUD, an individual or family household that's been residing in a place not meant for human habitation, an emergency shelter, institutional setting for less than 90 days, or they are actively in a domestic violence situation or fleeing domestic violence. So those are two households that would qualify for both those permanent supportive housing or transitional and rapid rehousing. Coordinated entry, it's not the best option for those households who are residing with friends or family for 7+ days. And that would be like considering doubling up. But there are options for those families. There are support networks and funding sources to try to assist those individuals and those families. And like I said, like if there are children attending public schools, they can access that McKinney-Vento funding. Sometimes they do have hotels and at least vouchers for short-term stays in hotels to assist those families. And you would access that through the actual homeless liaisons through the schools. And if you want to know more about that, I'm going to have my my contact information, and I'll put that in the chat, and you could reach out to me and I can explain a little bit more about those options. So also with coordinated entry, if somebody's in an institution for over 90 days, HUD considers them stably housed. So if they spent over 90 days, HUD considers that not homeless, even though if they were homeless prior to that, or they're going to be exiting into homelessness, they would have to be reaching an access point after they are released from that institution. And if they're currently renting or residing in a housing program, they're also not considered homeless. There is a caveat to that. If they had an eviction notice and it's going to take place within 2 weeks, that's imminently at risk of homelessness. And we can do that assessment for some folks in that situation, especially if they're youth. And we define youth as anybody under 25 years old. And so anybody that's under 25 and they are in that situation where they're going to be evicted, or actually even doing that couch surfing and doubling up, we can do this assessment with them and try to get them into housing, because they do have a little less restrictions based upon that youth status. And only households who are homeless under HUD's definition will be included on that prioritization list that we use for case conferencing. And typically that's because we're trying to get the folks that need the help right now and then into those housing services. So we try to keep those lists clean and up to date and accessible to the programs that are available currently. So if you're unsure about a specific client situation, that you come in contact with them in your medical practice or wherever you're actually in contact with that client, and it sounds like they might be in a situation that they could be either unstably housed or precariously housed, you can contact our Balance of State team and we can assess the situation. We can connect them with resources in their area because we do cover the entire state except for Albuquerque. And the Albuquerque team has their own resource list, and they're well versed in what's available in Albuquerque. but you can contact us or have the client contact us, and we can begin to problem solve with them. If a client is living in one location of the state and wants to be housed elsewhere, we can also begin that process and work towards transferring them. And we could do the assessment where they currently are and begin working with the agencies and the providers in the place where they would like to be relocated to begin to set that process up. So when they are able to relocate, they have things in actual motion rather than getting there and being completely lost. And once we're done with this presentation, we have a whole bunch of folks on our team that can assist. So we can get you a list of people on our team to contact and reach out to. And also just ask questions, general questions, if things come up in your area, you're part of the state, and you want to learn more about it. We do have a pretty decent knowledge about what's going on typically. And if you want to share something new that's going on in your area, we'd be happy to hear it as well. So, and like I said, there are those two offices that Leanne mentioned earlier in the Albuquerque office. So if you have a client that's seeking long-term or short-term assistance for permanent housing or transitional housing, and they're currently on the streets and shelter or in a car at night, you can go to the Albuquerque team and their coordinated entry team. And if you have a client who is not currently on the streets or shelter or their car at night, there's a resource site that you can help to. And so that has all kinds of information that's accessible all the time, because reaching out to the Albuquerque team, they keep normal business hours, but clients can access that website and kind of do their own research and learn more about what's available in Albuquerque. And there's that contact information for the Albuquerque coordinated entry team. And you'll get a copy of these slides if you'd like. And you could reach out to them if you are located in Albuquerque or you have clients that are in Albuquerque or want to relocate to Albuquerque as well. And so like Leanne mentioned, the Santa Fe office, which is Balance of State, covers the entire rest of the state outside of Albuquerque. And we focus on people that are literally homeless, that are living on the streets and shelters or in a vehicle. But if somebody is in that imminent situation, they got an eviction. Sometimes we talk to family members of people that are living on the street. And there's a lot of different folks that we do come in contact with, and just concerned individuals. Sometimes we get people from the neighborhood and saying, oh, they recognize this person that comes and goes. How can we find resources for them? Any of those questions we can try our best to answer. And we also have specific programs that are dedicated just to folks that are fleeing domestic violence, and that's like done anonymously, and we make sure everybody stays safe in that process, and it's dedicated just to that, as well as the program that I am the manager of, which would be the homeless youth clients. And the up north, so we have the northern 14 counties, we have a specific program that's made and designed for those folks that are under 25. And we are able to be a little more flexible with getting them into rapid rehousing or transitional housing. And so some of the strict rules that I mentioned earlier, they don't necessarily apply in these northern 14 counties. And it's what's called YHDP, which is the Youth Homelessness Demonstration Project. And we're actually trying to apply in Albuquerque for this grant, and in a southern portion of the state, so that we would be covered hopefully statewide with this specific grant, just to serve youth And that actual application process takes a while, so it hasn't been approved yet, but we do have that funding up north in the northern 14 counties. And so you can reach out to us at the email address or that phone number at any time. And I'm going to put my email address in the chat. And like I said, I do run that youth program. So if you do encounter clients that are under 25 and they're precariously housed, or they are living on the street or anything like that, you can reach out to me and I can try to find them resources or begin to start that process of getting them into housing. So if you would like to help and continue in this learning process, I know this is kind of a brief introduction and really does just scrape the surface. And you might have a lot of questions also after this presentation, which I'm happy to answer. I'm sure Leanne is happy to answer as well. But if you would like to have full participation in coordinated entry, which would mean like conducting those actual assessments and being able to do that directly with your clients and using that prioritization process for them to be able to find housing, what we can do is we can begin a training for you all. And that's a little more in depth about the VI-SPDAT and how to actually administer that, how to work with those clients, where to send it, which assessments to use. It goes more in depth into that process. And if you're interested in that, you would become like that access point and that entry point for clients. And then you'd be able to send those assessments to the coalition and get them entered into HMIS. And Leanne would be the person for you to contact to begin that training process. And she puts those trainings together, usually like maybe once a month, once every other month, to get folks fully on board and able to be that resource for the community. And so if you have any questions, like I said, you can reach out to that email address, that phone number. You can reach out to me in the email address that I provided. And we do have some time left. So if you have any questions that are urgent right now that you'd like to answer, then Leanne or I would be happy to answer.
Great. Thank you both. Great presentation. Let me just say that we're going to make this information along with the recording of the session available to everybody on our website shortly. Give us a day or two to do that. So questions? Anybody? We're small groups. I think you can just unmute and ask your question if you'd like. I have some. One of my questions was answered. So people living in a car are considered homeless. Is that right?
Yes, that is correct.
Okay.
Under HELP's definition.
That's great. And we did hear about any health councils here. Any of you interested in actually becoming an access point? Or any of the organizations in your council do you think might be interested in becoming an access point, an official access point? And if so, what I heard is we should contact Leanne or Forrest, if that's the case.
Yeah, if anyone was interested, they could definitely reach out to me, excuse me, because I do the coordinated entry system and the VI-SPDAT trainings. And so though that training is only takes about an hour and a half. And the VI-SPDATs, the housing assessments, really help us be able to show HUD the gaps within the state on where housing needs are lacking, or there's no housing resources available. And just because, you know, sometimes clients are not maybe fitting that definition of, you know, HUD homelessness, We also have our Balance of State CES line that anyone can call and access resources throughout the state, whether it's for housing, whether it's for eviction prevention, whether it's for finding food or just connecting to other resources and services. Albuquerque has a really extensive website for people needing those types of resources, but we're not really that far. We're kind of, we've really worked over the last 2 years on building coordinated entry and our system into what it is now. We started out with really like a team of 1 or 2, and it's up to 8 now. So we've really expanded our team in the last 2 years during the pandemic to really try and help provide resources for anyone that's needing any type of resources within the Balance of State or the state of New Mexico.
Leanne, could you repeat that again? If people have needs if they encounter people who have needs that do not meet the criteria for entry into the coordinated entry system or prioritization, did you mention a number? How do we access your information about other resources?
Yeah, so it's the Balance of State coordinated entry system line that we had in the PowerPoint, and that number I can provide for you when we send out all the presentation information.
Okay, great. And we will make that available to all of you all.
Wendy, this is Evangeline Zamora with the Grant County Community Health Council. I got in very late to this presentation, but what I did here, it sounds like something that I need to pursue and follow up on. We do have a task force for persons that are homeless. So we're starting that up and trying to get that going. So maybe this will be a resource that we'll probably pursue and just find out more information about. Thank you.
Great. And we'll make sure you have those contact
Awesome.
emails, phone numbers, so that you can get in touch with the experts.
Yes, I wrote those down. Thank you.
Okay, great. Great. Anyone else? Questions? Comments? Sarah, I'm looking at you because Sarah is our MSW intern who's helping a lot with our directory assistance, linking people with resources. We are always getting emails from people who say, I'm about to get an eviction notice. It sounds, Sarah, like we should be referring them to either Albuquerque or Balance of State. Is that right? If we are not an assessment point, but we do encounter someone who needs services, we can call one of you, one of these lines that just got put into chat. Yes,
and so our Balance of State line, it can be reached for anything Balance of State except for Albuquerque, but we can always, provide that or forward that information to our Albuquerque team. Or if it's a specific DV situation, then we have our DV coordinated entry line that you can call as well.
Okay, excellent. I think most people here are Balance of State.
Okay.
I just wanted to add, we were going to have another colleague join us today, but they weren't able to. We're going to be doing what's called a point in time count this upcoming the beginning of February. And one thing that is, it really helps to kind of get an idea and a picture of what communities are experiencing as far as this housing instability, and just to get a grasp of the numbers. And so the way that works is we pinpoint one day, and that's that point in time. So it's going to be January 30th is the day that we're going to be asking about. And we would ask folks like, where did they sleep that night? And typically we would ask this to individuals that we know are in instability or in that instability and living precariously, whether that's in shelters, in their car. And we would do that for the following week. So the beginning of February, we can ask back and be like, okay, where did you sleep on Monday? And we would go through this really quick survey to get that kind of data to be able to share with our funding sources, to be able to have some idea of what these communities are facing. And we've seen a growing number of calls and folks that are trying to access these housing resources. But it doesn't always show up in these point in time counts, because we do need boots on the ground. We need folks in the community that are willing to take that time and volunteer and go out and ask these folks where they were sleeping on that particular night. And so we do want to invite anybody and anybody's team to participate in the planning stages and to begin to talk about that, because it is coming up fast and the holidays are coming, and that kind of makes everything a blur. But if anybody is interested in that point in time count and participating and getting involved in the community in that way, we would welcome it. And we really do appreciate it if you were willing to participate and to help kind of share the burden in that process.
Forrest, would it be possible for you to put together just a one pager, a very brief description of what a point in time count is and how our health councils across the state might be able to support it? What would be involved, et cetera, et cetera? If you could send us something like that, we can make sure that all of our health councils receive that information.
Absolutely. And I could also send the real detailed information from the last year's point in time count, which it's not going to be a one pager. That's going to be something more in depth for folks that are really, really into it. But yeah, I could get that together, and Lucy might already have something for us to be easily shared. And yeah, I'll ask her to make sure I'm not duplicating the work, but we can get that out to you. Absolutely.
Excellent. This health councils, I think this would be a great way to learn more about your community. I think the information you get will not be happy information, but important information.
Yeah, unfortunately, that's the only way to change it, because in a lot of communities, there's the idea of out of sight, out of mind, not in my backyard, those kinds of prevailing ideas. And we just need to make sure that where the funding is coming from and the folks at the top and the legislative ladder of the way the system operates, that they're aware that this is a growing issue. And we see it because we access this call line, and we're talking to folks and really experiencing this alongside them. But that data doesn't show up immediately, and it doesn't really hit those legislation places, and unless people are out there and sharing that information. So as much help as we have in just highlighting and putting a spotlight on this growing issue, the better, I think. And like you said, Wendy, it's sad, but it would be sadder if we just ignored it and pretended like it didn't happen or wasn't happening.
Amen. Yeah. And health councils, you're doing your prioritization, your health assessments now, doing your prioritization. That's a great timing now to really think about the extent to which homelessness is an issue in your community and how you can help both document that in your health assessments, community health assessments, and also how you might want to help with the advocacy efforts to get more policy changes. HUD is awfully rigid. So maybe some policy changes and also some more resources allocated to this issue.
Yes, Wendy, this is
Yes.
Evangeline. This is Evangeline Zamora again.
Mhm.
We actually got some HB2 junior monies, and I know you're aware of that, but the rest folks might not be, to address a very, very beginning of what exists in Grant County in terms of people who are homeless. And so we are having some challenges, getting the information, but what we're hoping is that the result is a report that's useful to our legislators, our local legislators, and launch, maybe into a 50,000 isn't very much, but it's a start in terms of maybe providing information as you're stating. So that's what we're doing that right now. We have a few challenges in getting that information. So that's why this is so interesting to me to see if we can get more resources from Forrest and folks there.
Great, Evangeline. I bet they do have data as
Yeah.
well as that you might be able to. Great. And when you get that report done, be sure you share it with all of us. I have a feeling that the Coalition to End Homelessness might be interested in that report. Certainly, we will be interested, and we want to share it with your fellow health councils, because I'm pretty sure that all of our communities are experiencing this phenomenon, and we could all benefit from sharing what the needs are and what is working and what is needed. So thank you, Evangeline. We'll look forward to getting that report and sharing it.
Okay, thank you.
Anyone else? Sam, is this an issue in Curry County? Putting you on the spot? Are you there? Putting Sam on the spot? No? Okay. Any other questions, comments for our team? No? Okay, well, again, all this information will be available on our website sometime soon. And we wish you all thank you for coming and joining with us. We wish you all happy holidays. Wouldn't it be nice to have happy holidays for everyone in our community? Let's see what we can do about that. But we know now that we have some partners in this work. Leanne and Forrest, I want to encourage you and your Balance of State team to invite yourself to one of our Health Council meetings. They are open to anyone. And you might find some people there that can also provide resources back to you. And if we can work together on all of this, hopefully we can really make some inroads into this situation. But we really thank you for all you're doing, both in providing direct services and for advocating to meet those gaps in services. Thank you very much.
Wendy. Yeah, thank you so much for the invitation to present.
Okay,
Absolutely.
great.
Thank you. Thank you all.
Thank you.
all.
And I love your picture, Forrest. Who is this little person? Who is this little person?
That's my daughter. Her name is Ishel. That's when she was much younger. She's 10 now, but
Oh, okay.
my favorite photos of her when she was a baby.
Right. Again. Okay, thank you all. There are no other questions. We will have this information for you soon. Let's stay in touch. Okay?
Well, I-
Okay. Bye, everyone.
Bye-bye.